Hello, my friends. Dr. P in the house. It is Boxing Day. I hope everybody's having a happy and safe holiday. Um, and that things are going super well with everybody. We had a good holiday at my family. I had 15 total people yesterday for Christmas dinner, and I have to tell you, the souffle did not get made, but we had plenty of desserts anyway. I don't even know if anybody would have had any room for it. But I wanted to come to everybody today, and I wanted to talk about what probably one of the most contentious things that we talk about here at the office that isn't money. I'm going to actually do a money post next week because the new year is coming and we are raising prices, but we're raising them very strategically, and in some cases raising them because our prices are going up rather more than we had expected, much like most of y'all's. And I wanted to start this with some premises of how Dr. Indu and I and the staff practice medicine. And the way we think about it, and I literally have a post-it note above my computer here in the back that says we offer and expect excellence, right? I expect excellence out of my staff. I expect excellence out of myself. And when we say excellence, especially as that applies to all of our stakeholders, what that means for our clients is shared decision making and shared goals of care. Okay, and I may have one goal of care with your pet. Dr. Indu may have a goal of care with your pet, and you may have an entirely different goal of care with your pet. And it's extraordinarily important that those goals of care are lined up. Okay. And one of the ways that Dr. Indu and I have decided, and how the team and Francesca, our practice manager, and Cassie, our lead tech, how our hospital leadership team has decided to practice and to help align in goals of care is around low stress and fear-free handling. Okay. This is something that basically started with a veterinarian, Dr. Sophia Yin, who was a brilliant soul who was actually basically bullied to death. If you want to go look up her very sad story, and look at how people can actually treat veterinarians, it's pretty bad. But she really her life's passion was to bring the understanding that pets deserve to have comfort and care and feel safe in their healthcare environment the same way that we all deserve to feel safe in our healthcare environment. And from that blossomed this whole entire movement around how we can practice veterinary medicine so that the staff can stay safe, so that the pets and the pet parents can stay safe. I've been in rooms where pet parents have been bitten and scratched, and it's awful. And we can achieve the goals of care in ways that create increases in the human-animal bond. And so what I want to do today is I kind of want to go over how we think about this and how we approach fear, anxiety, and stress, FAS, in pets, signs, and that sort of thing. If we send you home on pre-visit pharmaceuticals, I will send you home with something that sounds a lot like what I'm about to present to you. And what I want you to understand is that your pet's body language, vocal language, barking, meowing, hissing, is communicating with us. And it's extraordinarily important if they are communicating to us that we listen. Like, that's kind of literally my job, right? And when they're vocalizing in certain ways, they are telling us that they don't feel safe. And we measure that not feeling safe as fear, anxiety, and stress, or FAS. We measure it on a scale of 0 to 5. 0 is the puppy who's like, oh my God, please give me a shot. And 5 is the, the cat or the dog that's like coming for us. Okay. We don't experience 5s very often. We experience 4s a couple of times a week. Usually most of our FAS patients are 2s and 3s, right? And a lot of our patients are 0s and 1s. And I will tell you, a lot of our patients on their pre-visit pharmaceuticals are also 0s and 1s. Okay, and when animals are in heightened fear, anxiety, and stress, their bodies are releasing stress hormones, right? Cortisol is a thing in their bodies the same way it's a thing in our bodies, right? Fight or flight. They are like, get me out of here, right? And they trigger their fight, flight, freeze response. We can see this in pets in dogs at the low end of the scale. The first thing they do is they get whale-eyed. And then it escalates, panting, trembling, hiding behind you. So that's a stress behavior. When your dog is like trying to crawl into your shirt while you guys are here, that's a stress behavior. Okay. They don't want to enter the clinic. We're dragging them in. Right. Their ears are pinned, their tails are tucked, and then it escalates to growling, snapping, and biting. Right. Lunging, that sort of thing. Cats, cats mostly we see them in freeze, okay? They look like they're being compliant, but they're terrified, and their heart rate, if I announce to you your cat's heart rate is 230, they're terrified. Okay. They also get dilated pupils, and then they get the pretty classic flattened ears, hissing, or, spitting, scratching, and biting, right? And every species goes through this, right? And if we think about it, that level of adrenaline, we call it, in human healthcare, we call it white coat syndrome. And that's why they have blood pressure machines at CVS, right? Because you'll get a more accurate blood pressure at CVS. And it happens to us too. I go to the VA and I will walk into the VA and you're just, you kind of get a little sweaty, your heart rate goes up a little bit. They're like, why is your blood pressure elevated? And it's because I'm scared, because that's what, lifetime of conditioning has done that to us. So this has impacts on the quality of care we can give your pet, right? We can't examine them as thoroughly as we would like to examine them. The diagnostic accuracy goes down. A dog that's like this, I can't palpate pain, right? Because he is never going to show me any pain whatsoever, right? A cat that is trying to turn itself into a ball is not going to react to me when I walk down its back with my fingers, right? And so I can't diagnose this accurately. When we do blood work, that cortisol changes blood pressure, heart rate, glucose levels, that sort of thing, right? Cortisol increases treatment recovery time, decreases healing, and what we have discovered is that when you, the owner, see your pet like this, you're actually less likely to bring them into the veterinary clinic, which is completely understandable, right? Who wants to see their pet going through this? And then it leads to this cycle, right, where every time it gets worse. And that's where pre-visit medications come in, okay? It's not the only thing we do to solve this problem, but in a lot of our patients, we've got to add meds so that we can get back to baseline, right? Or reset their body so they're less terrified to be in here with us. I mostly send pets home on trazodone, gabapentin, okay? Sometimes I use acepromazine. There are a couple of different protocols. And then there's one particular protocol, you can go look it up, it's called the Tufts Chill protocol. It's gabapentin, melatonin, which is over the counter, and acepromazine. In dogs or cats that are on fluoxetine or Zoloft or an SSRI type drug, we don't use trazodone, so if your pet is on that, please tell us, and I will not prescribe trazodone for them. And a lot of times in cats, we basically just start with gabapentin, but in dogs, we do really need traz and GABA. Okay, and we use these in combination so that we can, what's called polypharmacy, and it works on us and it works on our pets, right? We use these when we have a history of fear or aggression. So you may not know this, but it probably comes to you when we send you your charts, is that we mark charts. We have animals that say caution, we have the FAS level on the animals. We take notes as to what works with your pet. Loves peanut butter. Don't give peanut butter, food allergy in the house. We have all of those notes so that we can go into a room best prepared to serve you and your pet, right? I give preemptively a lot of pre-visit pharmaceuticals for cats. There are practices that will really only see cats when they're on gabapentin because they're so effective at hiding, and the car ride or the transportation over to the vet clinic is just so traumatizing for them. It can really change things in cats. We send home pre-visit pharmaceuticals anytime your pet has to spend the day with us because I put them, for safety's sake, right? I put them in a cage. It's a very unnatural thing, right? I mean, think of it from their perspective, right? They're used to spending the day on the couch, wandering around, going out when they want to, doing all these things, and all of a sudden they come to my clinic where there are multiple animals, people they don't know, they're getting poked and prodded, and they're getting locked in a cage that's an adequate size for who they are for the couple hours that they're going to be there, but is not set up like the Hilton, I will tell you, right? And in many minds, in my mind as well, it seems only fair, because we can't really explain that process to them, to give them some pre-visit pharmaceuticals, okay? And we see a ton of benefits associated with this, like improved client experiences. I cannot begin to tell you, because it happens to me every day, multiple times a week, where people come back in. So if your pet, just starts escalating, right? You come for a wellness exam, your pet starts escalating, they've never done it before. Remember, it gets worse year on year. They've never done it before. We will at some point say, if we can't finish, just, come back on PVPs and we'll just finish the exam, right? We no charge the exam portion of it because you already paid for it. They come back on PVPs, I can finish my exam, I can put my hands on them, we can get their annual blood work, that sort of thing. And the number of people who are like, I really didn't think that was going to work. I'm like, this was so much better. And you can see everybody in the house, in like the room, like visually relax. It prevents bad experiences on the pet. We get better labs. We get better medicine. When we do this, when we have surgery days and stuff, it lets us use less anesthesia because I've like less cortisol to overcome with my anesthesia medications. It reduces risk injury to them and to us as practitioners, right? It has long-term benefits. What most people don't understand is, and there's no reason you should, is that we don't usually have to do this forever. Once we counter condition your pet, this doesn't always work in cats, this really works in dogs, but in about 60 to 75% of dogs, I can counter condition them to coming to the office, where we get to reduce the amount of meds that they take when they come to the office. And as a result, they get better veterinary care. You have a better experience. We have a better experience. We're actually doing the things that make a difference when it comes to veterinary medicine. And that makes, like, that is where really we get to like shared goals of care and decision making and things like that, because all of a sudden we're all on the same page and we're allowed to do the same things. So that's what we have going on in PVPs. I have tons of reading on it, so if you would like it, just give us a call and I will send you everything you could possibly want to know on PVPs, on the drugs, on all of those sorts of things. We're really going to be, we're looking to get fear-free certified. It's called, I'll put some links in the notes once the video posts, and you can read some more about it. Thank you so much. Have a safe and happy holiday, and I'll be back next week with another fairly contentious topic, prices, money, and how things are going in vet clinics. Thanks so much, and y'all have a great day.